You might not give it much thought throughout the day, but your heart works continuously round the clock. If it doesn't receive the right care, serious problems might develop. Following heart-healthy lifestyle modifications can dramatically reduce the risk of developing a heart disease. Hi and welcome. I'm Dr. Lakshmi and you're watching the Health Talk session. So in our episode today, let's understand the conditions that can affect your heart and habits that help to manage or prevent them. Joining our discussion today is Dr. Rajasekhar, Senior Consultant Electrophysiologist and Cardiologist from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor, and thank you for joining us.
Thank you.
So not long ago, heart diseases were primarily a problem of older adults. It was very rare for anyone to get a heart disease 40 years and younger. But now, every 1 in 5 adults is younger than 40 years. So what is your take on this, Doctor?
It's a trend that we have been observing for quite some time now. In fact, if you look at the Indian population, compared to the Caucasian population, we seem to have a greater vulnerability to heart disease. And we seem to be affected by heart disease at least a decade or a decade and a half earlier than our Western counterparts. So it is a genetic predisposition which puts Indians at risk of heart disease at a younger age compared to the Caucasian population. That is one part of the story. The other part of the story is the changing lifestyle. The lifestyle is changing, and we are getting more sedentary, more of office workers, and our food habits are changing. We're not sticking to ideal good food habits, and there's a lot of junk food and a lot of unhealthy food that goes on because of lack of time or lack of resources or whatever reason. And sedentary lifestyle, because now most people are desk workers. They work on a laptop or on a computer or the system, and they hardly get any time to exercise. So that's an important factor that is responsible for heart disease. Also is important that the incidence of smoking and alcohol consumption has gone up exponentially in the younger population, and both these are very strong risk factors for heart disease in the young. And finally, we cannot discount the effect of stress. Work stress is affecting millions of Indians, especially young Indians across all professions. And this plays an important part in the causation of lifestyle diseases like diabetes, hypertension, and also these serve as triggers for heart disease.
So let's start by delving into the direct link between lifestyle choices and heart health. So can you explain how our daily choices and habits affect our heart health, Doctor?
Definitely. Lifestyle is a very important risk factor for heart disease. When we say lifestyle, it consists of several components. One is food. Second is physical activity. And third is habits, lifestyle habits such as smoking, alcohol, etc. So in terms of food, I think we are increasingly moving into a system where we rely more on refined carbs and processed foods for our nutritional requirements. So these are foods which have high glycemic index and which have an important role to play in the causation of premature diabetes and premature heart disease, and also have a certain role in the causation of hypertension. Also, the researchers have found that whenever the diet is predominantly based on a carbohydrate, whenever the carbohydrate content of the diet crosses 50% of our caloric source, then the risk of heart disease starts increasing significantly. So ideally, one should have a diet which is low to moderate in carbohydrate, high in protein, and has low to moderate amount of fat. So earlier concept that high fat diet is bad for heart is no longer valid, because a certain amount of fat is required for general health, and therefore a moderate intake of fat, especially good fats, is important for health.
So no doubt diet plays a significant role in our heart health. So can you elaborate what individuals should include in their daily diet, and are there any foods to be avoided, doctor?
So I think people who want to prevent heart disease should keep away from refined carbohydrates and processed foods. So refined carbohydrates are like refined sugar, polished cereals, or off-the-shelf food such as bread and biscuits and stuff like that. So people should go into more ethnic and more traditional sources of calories, such as complex grains, such as the traditional grains such as millets, complex carbohydrates which have high amount of fiber and which have enough source of protein, so that these have typically low glycemic index. They do not cause a surge in the insulin level because of rapid absorption of surge in the blood glucose, and they cause a surge in insulin level, and that causes insulin resistance and all the other metabolic disturbances. Therefore, people should opt for a diet which is more in complex carbohydrates, rich in proteins, and they should also look at consumption of healthy fats. What are the healthy fats? Healthy fats are those that increase the good cholesterol in the body, and these are also required for the general well-being of the individual. The sources of healthy fats are say nuts such as walnuts and almonds, and certain sources of fat such as avocado, and certain plant sources of fat. These are actually good sources of fat, and these are usually good for improving the heart health of an individual.
So physical activity is often emphasized for a healthy heart. So how much should individual aim for, and what are the different exercises or activities that you recommend, doctor?
Exercise is a very important aspect of heart disease prevention, because exercise is equivalent to one medicine for control of hypertension. Also, exercise also helps in regulating the blood sugar and controlling diabetes. So what are the type of exercise? The best form of exercise is moderate intensity aerobic exercise. Aerobic exercise is one that actually the heart rate goes up to a certain level and is maintained at that level. And the recommendation is that a minimum of 30 minutes of moderate intensity aerobic exercise, at least 5 times a week, is required for preventing heart disease. This is the minimum that is required. In fact, people can do more of this exercise and the benefit is likely to be higher. So aerobic exercise can be in the form of brisk walking or jogging or running or swimming or cycling. It can also be in the form of a sport such as badminton, tennis, squash, etc., depending on the individual preference and depending on the individual level of fitness. And it can also be in the form of hiking, mountain climbing, and so on and so forth.
So you've mentioned earlier that stress is a common part of a modern life. So what are the different effective ways that one can manage stress, and how does stress affect our heart health, doctor?
So chronic stress is an important factor that causes heart disease in people who are otherwise healthy. They seem to be eating normally, they seem to be eating healthy, they seem to be exercising, they don't seem to be overweight, yet they seem to have heart disease. Stress could be an important factor. Stress causes the release of certain hormones in the body called cortisol. So this cortisol has the effect of increasing the insulin resistance, is causing the blood sugar to spike, causing the blood pressure to rise, and all these finally contribute to heart disease. Therefore, stress is an important factor, not only in the causation of heart disease, but also in the aggravation and perpetuation of the risk factors for heart disease.
So tobacco is not only a risk factor for many other diseases, but also for the heart. So can you explain how quitting smoking can benefit heart health, and what support is available for individuals looking to quit, doctor?
Smoking is a very important risk factor for heart disease, because smokers have typically higher chance of having bad cholesterol. They have higher chance of having what is called plaque rupture and clotting in the arteries of the heart. In fact, in our experience, most of the people who have had a heart attack below the age of 40 have been traditionally based smokers. So smoking is a very important risk factor for heart disease in the very young. Therefore, quitting smoking is a very important step for both primary and secondary prevention of heart disease. So the person quits smoking and he remains abstinent from smoking, after 5 years, his risk becomes almost the same as a non-smoking person.
Sleep quality and duration are often overlooked when discussing about heart health. So what tips can you give to our viewers as far as sleep is concerned?
The lack of sleep is again a manifestation of stress. So stress causes lack of sleep, and lack of sleep also plays havoc with the hormonal systems inside the body. So lack of sleep means the body doesn't have time to recover, and therefore the body is continuously under chemical and physiological stress. So that also causes the cortisol levels to rise, and that also leads on to the cascade of insulin resistance, hypertension, metabolic syndrome, and heart disease. Therefore, most researchers feel that a minimum of 7 hours to 8 hours of sleep is ideally required for an individual to have adequate good quality of sleep, and this goes a long way in preventing heart disease.
So early detection reduces suffering and preventing many complications. So can you elaborate the importance of screening tests done, and ideally, when should one get this done and how often, doctor?
I think most individuals who are 25 years or more should have a cholesterol test or a lipid profile, especially if they have risk factors. They should also get screened for diabetes and hypertension, because these are silent diseases. Quite often you don't know whether somebody has got diabetes or hypertension unless somebody is tested or examined. So basically, I think anybody over 25 should have a general health checkup, and in the form of a physical examination, recording of the blood pressure, checking the blood sugar and the lipid profile. And people who have risk factors, including family history, should have more intensive investigations in the form of a ECG, echocardiogram, and also a treadmill test in some situations. There's one test called a coronary calcium scoring, which is useful. It screens the calcium by CT scan in the coronary arteries, in the arteries of the heart. And it's a good screening test to pick up heart disease in people who have risk factors, multiple risk factors for heart disease. And in some individuals, especially people who are over 40 or 50, there are multiple risk factors. We often recommend a test called a CT coronary angiogram, which is a very good non-invasive screening test to pick up heart blockages in the arteries at an early stage. So because once you pick up these blockages in the early stage, before they have caused substantial damage to the heart, we can treat them effectively and increase the not only lifespan of the individual, but also the quality of life of the individual.
So before we wrap this episode, doctor, is there any message you would like to share with our viewers as far as healthy heart is concerned?
So the heart is like the engine of life, and it keeps ticking to keep us alive and kicking. So it's important that we know about our heart, we understand how the heart is functioning, and we also continue to take care of our heart. So taking care of our heart means that we take care of a lot of things, including our food habits, our exercise habits, keeping our body weight under control, taking care of risk factors such as diabetes and hypertension, and also keeping away from habits such as smoking and excessive alcohol consumption.
So thank you, doctor, for joining us and sharing your valuable insights on lifestyle modifications on healthy heart.
Thank you.
So this brings us to the end of this episode. Remember that taking charge of your heart health is well within your reach. Stay informed and prioritize your heart. We at Yashoda Hospitals are more than happy to answer your heart health related queries. Don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.